Hey, I'm Dr. Joffrey, emergency medicine physician, keeping it simple in 5 minutes or less. 8 warning signs for prostate cancer. Again, 8 warning signs for prostate cancer. Let me set it up. About 1 in 9 men will be diagnosed with prostate cancer at some time in their life. Who's at risk for developing prostate cancer? Any male who has a prostate. Any male who has a prostate. Now, if you have a brother or a father or someone in your family line who has had prostate cancer, you are 2 to 3 times more likely to develop prostate cancer. It most often happens after the age of 50, but about half of the cases occur after the age of 65. And the main risk factors are a family history, obesity, and smoking. Now look, early on, there are no signs of prostate cancer, but early on when you have prostate cancer, there are no signs. But as the disease progresses, you start to develop signs. And here are the top 8 signs. You have a weak urine flow. And these signs can be confusing because some of these are just associated with getting older. You have pelvic pain, just for no reason. It's achy, it hurts. Frequent urination, especially at night. Again, frequent urination at night. And then sometimes you experience urinary incontinence, which means that your urine just leaks for no reason. It's often when we're coughing or when we're lifting heavy weights or suddenly moving, we'll experience urinary incontinence. And believe it or not, we experience difficulty controlling our bowels. Yeah, because of where the prostate is located, that is a symptom. Number 7, painful ejaculation. Oh, it hurts when you ejaculate. And then number 8, you have blood in your semen and sometimes blood in your urine. So those are the 8 signs. Now, the question is if you have those signs, do you have prostate cancer? No. And actually, I look back to one of my earlier videos where we talk further about prostate cancer and some of the non-cancerous signs of prostate cancer. In other words, just because you have these signs does not necessarily mean you have prostate cancer. It can be a number of different things that we talked about in a different video. Now, how do you lower your risk of developing prostate cancer? How do you lower your risk? A few different things. Regular prostate screening, meaning a digital rectal exam. Yeah, I get it. You got to have someone stick their finger up your rectum and feel your prostate. However, if you're not going to do that, the most important one is to make sure you get a PSA level, prostate specific antigen level. That is a blood test. To have that screen done yearly is essential, especially after the age of 50. However, if you have risk factors, after the age of 40. Ideally, you would prefer to have both, but if you're only willing to do one, absolutely the PSA level. And then maintaining a healthy weight. As I mentioned earlier, obesity is a risk factor for prostate cancer. Regular exercise has been shown to help decrease the likelihood of you developing prostate cancer. And diet plays a role. It's a little nuanced, but let's just keep it simple. A low-fat diet consisting of low processed food and rich in greens and vegetables, in greeny vegetables. And then this is the big one. Stop smoking. Stop smoking. Smoking has been directly correlated also with the development of prostate cancer. Hey, man, and family members. These are signs to watch out for and to watch out for over time. And if you develop some of these signs, make sure you go see your primary care doctor right away. If there's anyone out there who does not have any insurance, most public health departments have some kind of free screening, especially as it relates to prostate cancer. If you found this video helpful, be sure to hit subscribe, like, or even leave a comment. And I look forward to seeing you in my next video where I will be discussing signs of prostate cancer that family members should be aware of. Meaning that if they notice these signs, it lets them know, hey, that's something that I need to let my loved one know about. I'll talk to you soon.